Welcome to This Explainer. Today, we are unpacking the colossal machinery behind India's pandemic response. We're going to figure out exactly how the world's most populous democracy navigated a true generational crisis. We're talking policy design, ground-level logistics, and the raw human impact of managing a biological threat on an absolutely unprecedented scale. Let's jump right in.
So let's start with a staggering number that really defined the onset of this whole crisis. 4 hours. That's it. Just 4 hours of notice was given to 1.3 billion people before a strict nationwide lockdown kicked in on March 24, 2020. I mean, just imagine the logistical and societal shockwave of halting a nation of that immense size in less time than it takes to binge watch a couple episodes of a TV show.
To really understand the anatomy of this response, we're going to break this explainer down into 5 key pillars. We've got the legal shockwave, the human toll, the economic bailout, the vaccination mammoth, and finally, a blueprint for the future.
All right, pillar number 1, the legal shockwave.
Let's look at how the government rapidly centralized authority. The WHO declared an emergency in late January. Then, fast forward to mid-March, India invokes the Epidemic Diseases Act, and just days later, the Disaster Management Act. This all culminates in that 21-day nationwide lockdown on March 24th. The governance strategy here was remarkably fast, especially when you consider they pulled this off without actually declaring a constitutional state of emergency.
But here's where it gets really fascinating. To enforce this, they basically duct-taped together 2 very different legal tools. On one hand, you have this archaic 1897 colonial law, literally designed for the bubonic plague, which, as you can guess, completely lacks modern operational mechanisms. So to make up for those massive blind spots, they paired it with the 2005 Disaster Management Act. This modern act allowed the central government to establish a rigid, top-down command and control structure, legally compelling state governments to follow central directives to the absolute letter.
Okay, moving to our second pillar, the human toll. We have to look at the ground reality of that sudden enforcement. Human rights assessments, like those from the Housing and Land Rights Network, highlight a pretty sobering reality. While the lockdown was widely recognized as a public health necessity to stop the spread, its extreme suddenness disproportionately hit folks who are already living in vulnerable situations. The lack of extensive pre-planning meant the poorest segments of society simply did not have the resources or the safety net to just shelter in place.
The micro-level reality here was devastating. Daily wage and migrant workers, who often lived right at their workplaces in the informal sector, suddenly faced homelessness and a total loss of livelihood. With state borders sealed shut, massive displacement kicked in. On top of that, fundamental rights to food and housing were severely compromised. Even routine health services, things like tuberculosis treatments and standard childhood immunizations, were completely disrupted. This crisis laid bare some deep societal vulnerabilities that were immediately amplified by the lockdown.
So with the economy completely frozen, livelihoods vanishing, and human suffering on the rise, how exactly does a nation cushion an economic blow of this magnitude?
That brings us to pillar 3, the economic bailout.
To keep the country afloat, the government engineered massive multi-tranche relief packages. It was a high-wire act of balancing immediate subsistence with long-term economic survival. You had the PM Garib Kalyan Yojana providing vital, immediate relief. Think free food grains and direct cash transfers to the most vulnerable. At the same time, the Atmanirbhar Bharat Abhiyan and the Reserve Bank of India stepped in for the broader economy. They injected liquidity, cut repo rates, and offered collateral-free loans just to keep small and medium enterprises from completely going under.
But you really have to grasp the sheer scale of this intervention. The total fiscal and monetary support reached nearly 30 lakh crore rupees. That is roughly 10% of India's entire gross domestic product. It's a monumental financial mobilization, and it really puts into perspective just how much capital it takes to cushion an entire economy from sudden collapse.
Now, once the immediate shock was somewhat managed, the focus shifted to the long game. This leads us to our 4th pillar, the vaccination mammoth.
The geographic and demographic hurdles here were frankly immense. We're talking about incredibly densely packed urban camps, designed for rapid inoculations, all the way to health workers literally traveling by camel across the desert. They did whatever it took to ensure that every single eligible citizen, no matter how ridiculously remote, was reached. Administering over 2.21 billion doses, which, by the way, is about 17% of all doses administered globally, required a hyper-structured, phased rollout. They started with frontline workers in January 2021 and systematically expanded eligibility.
A huge turning point was the Har Ghar Dastak campaign in November 2021. This was an incredibly ambitious door-to-door mobilization to catch anybody who might have fallen through the cracks. Thanks to this structure, India delivered its first billion doses in just 9 months.
And domestic innovation absolutely fueled this drive. India didn't just import solutions. They developed indigenous vaccines like Covaxin and Zycov-D, which was actually the world's first DNA-based vaccine. Crucially, they relied heavily on Covishield. Why? Because it can be stored at standard refrigeration temperatures, around 2 to 8 degrees Celsius. This entirely bypassed the impossible ultra-cold chain barriers that plagued rollout in other parts of the world. Pair that physical logistics win with the COWIN digital platform for real-time tracking and the EVIN system monitoring cold chain temps, and you've got an absolute masterclass in public health logistics.
Which brings us to our fifth and final pillar: blueprint for the future. Experts across the board agree that to avoid repeating past mistakes, India has got to retire those colonial-era laws we talked about earlier in favor of a modern, comprehensive Public Health Act. The future blueprint relies on what's called a One Health approach. This is a holistic strategy that seamlessly integrates human, animal, and environmental surveillance. It also means creating dedicated, skilled public health cadres at the state level and building a unified framework to actually share disease surveillance data across clinical, research, and industry partners. This One Health approach, it's exactly the kind of preparedness blueprint that dictates how safe you and I will be during the next inevitable outbreak.
So, we've seen the incredible mobilization of funds, the clever legal maneuvering, and the outright logistical miracles of the vaccination drive. But as the dust finally settles on COVID-19, we are left with a critical question. Are our global and national health systems genuinely transformed by these harsh lessons, or are we simply waiting for history to repeat itself? Thank you so much for joining me on this explainer. Keep questioning, keep learning, and I'll see you in the next one.